Congratulations, you've finished the active part of your treatment and you're now entering a phase that we call retention. This is the process whereby we hold your teeth in the new position, and it's really, really important. If we don't hold your teeth, the teeth are going to move, not all the way back to where you started, but they're going to move away from the position that you're now in. That's almost always a disappointing thing for patients, parents, and also disappointing for us. So we need you to handle the next part of the treatment really, really well. Retainers are replaceable, but if you really look after them well, they should last for many years. If there's a problem with them, you need to come and see us so we can see the problem and either replace the retainers or give you advice or trim them or do something to make them wearable and effective again. Retainers are clear, they're comfortable if worn well, and we will be monitoring you with the wear of the retainers for the next 2 years until we say goodbye. At that point, you'll have finished with us, but if you have problems in the future, you're always welcome to come and see us, and we can either replace them or adjust them again, even 2 or 3 years after this. Initially, the retainers are worn because your teeth are all slightly mobile after we finish the active treatment, so we ask for 3 months of full-time wear. This allows the bone and the periodontal ligament to tighten and hold your teeth. Once the 3 months of full-time wear has passed, we then reduce the wear down to 14 hours, where you're basically wearing them from about 6 in the evening to 8 in the morning, so while you're at home. The other 10 hours during your busy hours during the day, you're not wearing them, so it's a nice reduction in wear to allow you to carry on your life without having to wear the retainers. After 6 months of 14-hour wear, we drop it to nights only. At this point, they're only worn while you're sleeping, and that's much more manageable. After 2 years, the retention phase with us is finished, but you'll still be wearing your retainers, even if you wear them a few hours less or a few days less every week. We would suggest you carry on wearing them because your retention needs to carry on into the future. But it can reduce. You might get down to a stage where you're only wearing them 2 or 3 nights a week after a few more years. But don't throw them away. They're always useful to put back in if you need them. The retainers will eventually wear out. Now, they don't wear out at the same pace for everybody. Some people will find that they chew through their retainers much faster than others. It's all to do with grinding, usually at night. If your retainers start to wear out or deform or not fit, or even if they become too tight, anything at all, you need to come back and see us. Just like shoes or anything else that's wearable, they will eventually wear out, and we're here to replace them if you need that. We do have patients that keep good retainers intact for 15 years, but we have other patients who possibly grind their teeth that might find they need new retainers after only a year or possibly 2. Retainers, if they're going to be worn every day or even every night, do need to be kept clean. So please, when you brush your teeth, clean your retainers. Use your toothbrush and use water and a little bit of toothpaste if necessary, and that will keep them clean. Otherwise, there will be a source of bacteria, and that isn't good for your oral hygiene. Again, a massive thank you to you for coming to us for treatment. We really want to support you during your journey in retention. And don't forget that almost everybody knows someone that didn't wear their retainers and they regret it. Please get this part of your treatment right. It's just as important as wearing your braces correctly and getting you that final result. Let's hold on to this result and keep it and preserve it. And we're here to help you. So good luck with your journey and get in touch if you have any problems. Thank you.